Imagine waking up on a Monday morning feeling perfectly healthy. By Friday, an unforeseen complication has you being rushed into an emergency room. Surviving the immediate physical trauma is only the first phase. As you transition into recovery, a severe financial crisis begins for millions of families. In a standard consumer market, you exercise agency before a major purchase, like a car. You compare prices, read through reviews, and negotiate the final terms. The healthcare market operates differently. Urgent physical distress removes your ability to price shop or evaluate options, forcing you to accept services under duress. This creates a total market anomaly. You are forced to commit to the most expensive service of your life while completely blindfolded, often discovering the actual cost only weeks later. When that medical bill finally arrives, the sheer scale of the total can be a shock. The document is often opaque, hiding the complex machinery behind the numbers. On the surface, you see the direct costs, the physician fee for specialized labor, and the facility fee for hospital infrastructure. Expanding the bill reveals secondary charges. Medical equipment, pharmaceuticals, and administrative fees populate the list, compounding to drive the final total significantly higher. Macroeconomic factors push these baseline prices upward. Hospitals are constantly investing in expensive new technologies and managing the highly specialized needs of an aging population. The complexity of modern administrative overhead acts as a massive multiplier. This bureaucratic layer causes healthcare inflation to consistently outpace the general economy. The final number on your bill represents the compounding result of this invisible systemic bloat, passed directly from the institution to the patient. Many people assume that having health insurance provides total financial immunity against these costs. Even with coverage, patients face significant hurdles. You must still clear deductibles, pay set copays, and cover coinsurance percentages before the insurance company pays its share. Perhaps the most dangerous structural trap in the system is surprise billing. It happens when you receive care at an in-network facility but are unknowingly treated by an out-of-network specialist. This disconnect triggers massive penalty fees that your insurance won't cover. Behind the scenes, hospitals and insurance companies engage in aggressive, opaque negotiations. When they fail to agree on a price, the patient is left legally responsible for the contested difference. Insurance is often a porous safety net. These structural market failures shift devastating financial liabilities directly onto the consumer. An unexpected bill can trigger a rapid financial cascade. Families often drain their savings first, then move to credit cards, and eventually secure high-interest loans to manage the debt. The long-term consequences are severe. This debt forces families to permanently delay home ownership or postpone retirement plans for decades. The psychological toll is perhaps the most dangerous outcome. The fear of incurring more debt leads many patients to ignore their symptoms and skip future medical care, literally pushing the problem away. Systemic medical inflation creates a financial trap that continues to derail human lives long after the physical body has healed. Navigating this system requires a proactive defense. Financial literacy, specifically understanding your policy limits and maintaining emergency savings, is essential before an incident occurs. After receiving care, always demand an itemized bill. You can then scan for administrative errors and use the document to negotiate a manageable payment plan with the hospital. While individual patients cannot fix macro market failures, applying this knowledge serves as a reliable shield against personal bankruptcy. A medical emergency is a test of human biology. Your financial security should remain intact throughout the recovery process. If you enjoyed this look at the hidden economics of everyday life, subscribe for more.